Good afternoon, and welcome to the Johns Hopkins 30-minute COVID-19 briefing, where we provide live insights from the experts who lead our work at the Johns Hopkins Coronavirus Resource Center. For the next half hour, we'll focus on what you need to know right now about the COVID-19 pandemic and public health responses. We'll be offering these 30-minute briefings regularly on Fridays at 12 p.m. I'm Dr. Lainie Rutkow, a professor at the Johns Hopkins Bloomberg School of Public Health, and I'm part of the leadership team for the Johns Hopkins Coronavirus Resource Center. We'll be providing answers in real time today, so please submit your questions in the box at the bottom of your screen. Today I'm joined by two guests. First, Dr. Jennifer Nuzzo is a senior scholar at the Johns Hopkins Center for Health Security and an associate professor at the Johns Hopkins Bloomberg School of Public Health. Jennifer will give an update about trends that we're seeing in the COVID-19 data. Then we'll hear from Dr. Bill Moss, who's executive director of the Johns Hopkins International Vaccine Access Center and a professor at the Johns Hopkins Bloomberg School of Public Health. Bill will give an update about COVID-19 vaccines. I'm now going to turn to each of our speakers for a brief overview. Jennifer, first to you. In the US, it seems like feelings of optimism are starting to surface with cases and hospitalizations declining and deaths potentially reaching a plateau. So, do these developments in the US reflect the state of the pandemic in the rest of the world?
Thank you, Lainie. Yes, there is reason to be optimistic. Anytime we see what is now sustained declines in cases, I will take that optimism. And certainly where we are today is looking much better than it has in previous weeks. About 11% fewer cases reported this week than compared to last week. And we saw declines last week as well. So when we have it for 2 or more weeks, we start to think that this is a real trend here. So that's encouraging. We're also seeing some declines in hospitalizations, which is very much welcome, given really that the trends have been opposite for quite some time. As you mentioned, deaths seem to be plateauing, and I expect that if these cases and hospitalizations continue to decrease, that we will soon see those decreases show up in deaths. So that is absolutely encouraging. But there are still places where I remain worried. And I just want to point this out as a note of caution, because there is by no means a reason to believe that these trends are fixed. Certainly, if we start changing things, change our behaviors, we could see case numbers increase again. And it really speaks to the urgency of acting to get as many first and second doses into arms as possible, so that we can help mitigate potential rise in hospitalizations or deaths perhaps later in the season as people travel for the holidays and begin to gather indoors. That's certainly a possibility that will lead to a rise in infections. But if we make good progress now in vaccinating people, hopefully we won't see that translate to a rise in hospitalizations and deaths. So while it's good news overall right now in the US, there are, of course, places where we still have to remain worried. And as of this week, there are about 12 states that saw an increase in cases. They are primarily in the east and the west, the northeast and the west. There are a few states where those case increases are, 10% or more, about 6 states. So I have New Mexico, Maine, New Hampshire, Nebraska, North Dakota, and Alaska saw the biggest case increases this week on a percentage basis. And so we have to very much continue to pay attention to those states. Perhaps Alaska is getting a lot of attention in the news as of late because of its very, urgent situation in terms of the rise of cases and hospitalizations that it's seeing there. Particularly disappointing because Alaska was one of those states that was very first out of the gate in terms of getting vaccines into arms, but clearly has more work to do to increase uptake to prevent people from winding up in the hospital. Globally, the situation is also looking a bit more optimistic. We are seeing the global case numbers fall this week, which is very much welcome because, again, the global situation has been so dire for so long. That said, there are still parts of the world where the case increases are quite substantial. So continuing to look at Eastern Europe and some parts of Asia. Countries that have seen the most case increases this week are Serbia, Mongolia, and Cuba. These are the highest per capita case increases. So still very worried about the the global situation, in particular because we know that being able to identify cases is very much a capacity dependent exercise. And so we don't always get the full picture of how many infections are occurring if people are not being tested. So that still remains the kind of general caveat to the global numbers that we should be mindful of. That said, in terms of what we're seeing, in terms of the case numbers being reported globally, I would be remiss if I didn't point out the fact that Alaska, West Virginia, Montana, and Wyoming are each reporting more cases per capita than any other country in the world. So really much more work needs to be done to control the spread of COVID here at home. Although we are seeing, as I said, a decrease in cases this week, we are still many times above what our lowest numbers were back in June. So, cautious optimism, but let's not, gain too much comfort in that and assume that it's fully that the worst is behind us.
Thanks so much, Jennifer. And before I turn to Bill, I want to remind our audience, please do submit questions for our experts to answer. We'll be moving to Q&A shortly. I do see your questions coming in. Bill, in the US, we now have some populations that are clamoring to get a booster, while others remain entirely unvaccinated, and the rest of the world continues to face a truly significant COVID vaccine shortfall. So how do you square the US booster guidance with the global vaccine situation?
Yes, Lainie, there's been a lot of debate about this issue, and the administration of booster doses in the United States and other high-income countries raises a number of very serious ethical concerns. The number 1, 2, and 3 priority, both here in the United States and globally, is to vaccinate the unvaccinated. And I think despite claims to, quote, follow the science, I don't think that was always done in the case of the booster doses. But first, the US recently surpassed a very tragic milestone, and that is that more people have died of COVID-19 in the United States than died here in the United States during the 1918-1919 flu pandemic. That number is 675,000. The US is now approaching 700,000 deaths. I think even more telling is that almost 15% of all deaths from COVID-19 globally have occurred in the United States. During the 1918 flu pandemic, that was only just over 1%. So there's been a disproportionate number of deaths here in the United States, recognizing that there is underreporting in many countries. But back in 1918, we had very little understanding of what even caused influenza. Most people thought it was due to a bacterial disease. We didn't understand viruses at all. And certainly we had no vaccine against influenza back then. So it's quite tragic that given all of the advances in vaccinology, in public health, in the science over the past 100 years, we have surpassed the number of deaths from the 1918. Now, I recognize the US population is much greater now, but that's still a tragic milestone. Even in the past couple of months, since about mid-June, there have been about 100,000 deaths in the United States. And 97% of those deaths have occurred in unvaccinated individuals, despite the fact that vaccines have been available for months. They've been accessible to the vast majority of people. And to put it bluntly, perhaps a bit unfairly, but I'm going to put it bluntly, about 2,000 anti-vaxxers die per day in the United States. Now, I realize not all of those people are staunch anti-vaccine believers, but they have declined to get a vaccine despite its availability and despite the fact that it's free. So here in the United States, our coverage remains relatively low. Overall, if we look at the U.S. population, about 55% are fully vaccinated. Of those eligible for the vaccine, we're at about 2/3. And there's a real age gradient in vaccine coverage. With those over 65 years of age, group at high risk for severe COVID, 83% are fully vaccinated. But if you look at that 12 to 15-year-old age group, it's only about 44%, despite the fact that the vaccine has been available. A Pfizer vaccine has been authorized since May of this year. And so there's been a lot of talk, Lainie, obviously, and concerns about, getting vaccines to younger children. The next group will be those who are 5 to 11 years of age. Last Friday, we talked about the press release from Pfizer on September 20th, showing the safety and immunogenicity of the vaccine in children 5 to 11 years of age. And I want to stress it's the immunogenicity, looking at neutralizing antibody levels rather than vaccine efficacy or effectiveness. And then we heard just this week on September 28th that Pfizer submitted these data to the Food and Drug Administration, and that they will shortly file a formal application for emergency use authorization. The big news last Friday, as we talked about, was around the booster doses, following a week of discussions among the FDA and their advisory panel, as well as the CDC and its advisory panel. Now over 4 million doses of booster doses, which include the additional doses as well, have been reported in the United States. Making up about 2.2% of all fully vaccinated people. So just in the past week, more than 4 million booster doses administered. If we look globally, it's about 30 million additional doses or booster doses have been administered. And so that does tie into these global inequities. I do want to say that there are a number of remaining questions, outstanding questions around booster doses. We don't know how long they last, how long that protection lasts. There are obviously great interest in understanding the need for booster doses for those who've received the Moderna and Johnson & Johnson vaccine. These booster doses are Pfizer's vaccine, Pfizer-BioNTech, and really more information about mixing vaccine types. But globally, Lainie, and this relates to that issue around booster doses here in the United States and other high-income countries. More than 6.27 billion doses have been administered globally. Remember, we've talked about the need for about 11 billion doses globally to reach 70% of the population, and about 3.56 billion people have actually received the shots, and that's just under half of the global population. But there's huge inequities in global vaccine coverage, with particularly countries in Africa, getting less than 5% of people have been fully vaccinated. And so the World Health Assembly had set a goal to have 10% of the population vaccinated in every country, and about 70% of African countries have not met that goal. This is in large part because many of these countries were dependent on COVAX, which ran into a number of problems, manufacturing and shipping problems, the issues in India with the Serum Institute of India not being able to export vaccine doses, and the fact that a large number of pledged doses have not actually come through. So the wealthy countries, including the United States, still need to do much more to address these global vaccine inequities, and particularly in the face of providing additional booster doses to some parts of the population. And I'm going to pitch this idea once more, Lainie, and then stop. But I think it would really help the perceptions around this if countries like the United States pledge to donate a certain number of vaccine doses, maybe 5 vaccine doses for every booster dose administered.
Thanks so much, Bill. What a helpful but also somewhat distressing update. Before I turn to Q&A, I want to remind those who are watching that you can sign up for our weekly newsletter. It's called The Week in COVID-19. It is a great way to get the latest insights from our experts about the virus itself, variants, and other critical trends delivered to your inbox on Mondays. And I'm now going to turn to the questions that are coming in. And I see quite a lot. So, Bill, I'm going to start with you. No surprise, lots of vaccine questions this afternoon. So the first is, can you speak to an update on vaccines for children age 5 to 11? Where do things stand? What's the likely timeline?
Yeah, so what we're waiting for is Pfizer BioNTech to submit the formal application to the FDA for emergency use authorization for the vaccine for those children 5 to 11 years of age. We expect that to happen soon. It's hard to predict how long it's going to take the FDA to review those data. And, here's the tension. We want a rigorous review by the FDA of both the safety and, in this case, the immunogenicity of these vaccines in younger children. We don't want to cut corners, but we also want this done expeditiously. And so I think it's still realistic that by the end of this month, now the month of October, we could have an emergency use authorization from the FDA and recommendations from the Advisory Committee on Immunization Practices and the CDC. But it's really going to be a function of, what data Pfizer submitted, what the FDA thinks of those data, how long it takes them to review it, whether they have additional questions. But I still think the end of this month is a realistic timeline.
Thanks, Bill. And to follow up on that last piece, once the relevant government messages and guidances and authorizations have happened, how long after that do you anticipate it will be before there are actual shots in arms for kids age 5 to 11?
Yes, I think once we have the both the FDA authorization and the CDC recommendations, it can happen very quickly within a day or two. We saw that process play out with the booster dose recommendations, where almost immediately after Dr. Rochelle Walensky issued the CDC recommendations, we started seeing booster doses administered. So I think I don't anticipate that there'll be any long delay following the authorization and recommendations.
Thanks, Phil. And just to close out this topic, the vaccines that we anticipate will go to children in this 5 to 11 age group. Is it a different formulation? Is it just a smaller dose of what the adults received?
Yes, it is not a different formulation. It's the same vaccine, but it is a lower dose. So the vaccine that's been administered, this is the Pfizer BioNTech vaccine, for that the dosage that's been used in those older than 12 and older is 30 micrograms. This is a third of that for the 5 to 11-year-old age group, so 10 microliters, so 10 micrograms. So it's a third of the dose, and that came out of studies that Pfizer BioNTech did, but they see very good immunogenicity in terms of neutralizing antibodies.
Thanks, Bill. Jennifer, a question for you, and this is something that we hear a lot. Is it true that deaths and hospitalizations have actually increased when compared to this time in 2020? And how is that possible if we now have vaccines and presumably more of the population that's been infected with SARS-CoV-2 and now also has additional immunity? So is it possible that some of these metrics actually look worse than they did a year ago?
Well, the surge that we're seeing now is bigger than the surge that we saw this time last year. We did see a surge last year, but it was a bit later. So there's a little bit of a shift there. I think we have to remember that the the hospitalizations and deaths are still, by and large, occurring in people who have not been vaccinated. So that very much underscores the fact that this pandemic is not over, and it won't be over. And in terms of our concern about hospitalizations and deaths, until we make more progress vaccinating people. So, I think that the weeks to come will be encouraging in terms of increasing vaccine uptake. We've already seen an increase in vaccine uptake. I think as employers are implementing mandates, we will continue to see increases. And so I think heading into that period of time where we saw the big surge last year, first of all, we could still again see a surge, because anytime we switch up our behavior, travel for the holidays, do those things that we haven't been doing as of late, we could see a surge. But I think we could be better protected against the kind of deaths and hospitalizations that we saw that time last year.
Thanks, Jennifer. Bill, what are your thoughts about receiving a COVID vaccine, or for some, a booster, and then receiving a flu vaccine? Is there a certain amount of time that you'd recommend waiting? Can you get them both on the same day?
Yes. First of all, I want to encourage everyone to get their influenza shots, but one can get them the same day. There's no need to space them out. They're compatible vaccines. So someone could go and get their COVID-19 vaccine and get an influenza vaccine, but it's going to be very important, I think, this year. There's a lot of uncertainty about what this flu season is going to look like, because of there has been a decreased transmission of influenza viruses, probably as a consequence of our public health mitigation measures against COVID-19. But we could see a very severe influenza season. But the bottom line is, Lainie, they can be given the same day.
Thanks, Bill. Another question for you about where things stand with FDA and Moderna, not necessarily the booster, but just the application for full approval. And just to give full context to those who are watching. So Pfizer has received full FDA approval. Moderna is still in an EUA, emergency use authorization status. So that's the bigger context for this question to Bill.
Yes, and exactly. And, I don't know specifically, the timeline for that. The Moderna applications to the FDA have been a couple months behind Pfizer, just in terms of, their data collection process and when their studies were started and the data has accumulated. So I still think it's probably a couple months away, but that's not completely certain.
Got it. Thanks. And Bill, to pick up on the global vaccine supply and the situation, I know this is something you cared very deeply about. From a global perspective, is production of COVID vaccines increasing? So is the supply there, or will it be there to meet demand?
Yes, there are certainly efforts to increase production capacity globally, and this is one thing that the Biden administration has said that they are going to invest in and support and promote. But we're still talking about maybe being able to meet the demand sometime in late 2022. So yes, capacity is increasing, but it's still a long time away, and we're still, as Jennifer outlined, in the midst of this terrible pandemic. So I'm afraid it's not going to come soon enough, but there are efforts to increase supply. I'll also say that these are quite complex biological products. And it's not simple to scale up the manufacturing. Jennifer and I were talking recently about issues with the Novavax vaccine and some of the problems that they have encountered with the manufacturing process. So yes, attempts to scale up manufacturing, not a simple process, and it's not going to be soon enough.
Thanks, Bill. I'm a little offended to learn that you and Jennifer have been talking about Novavax without me, but I'll get over it. So question using a term that I know you both don't love, which is breakthrough infection. So Bill, can you talk us through how is it possible that someone who is fully vaccinated can still have COVID, get very sick and potentially even die.
Yes, and I want to give Jennifer a moment on this because I know she feels passionate about that term and not using it. But here, yeah, I'll give kind of the immunologic bottom line. And I heard a colleague recently present it this way, that we basically have two walls. One is the level of neutralizing antibodies that are present that can really neutralize the virus, as it kind of enters our body. The virus has to enter our body for the vaccines to work. The second wall is our memory immune response, and this is, those high level, that first wall, that's going to be short term because we don't maintain high levels of neutralizing antibody. As we've said before, if we did that, our blood would just become so thick it wouldn't even be able to flow from all the pathogens that we've been exposed to. So these neutralizing antibody levels go down, and that's going to allow the virus to do some replication, and perhaps even cause some mild or moderate disease. But then at that same time, our memory immune response is kicking in, and that's what basically prevents severe disease. So it's not unexpected that people who are vaccinated can get infected and can even get mild or moderate disease, because this virus replicates really quickly, and so it becomes an arms race between the virus and our memory immune response. Now, some people who have impaired immune responses, whether that's because they have an underlying disease or are older, then the virus might even be able to cause severe disease and even death in a vaccinated individual. That's very, very rare, but that small proportion of deaths or severe disease that are occurring in vaccinated individuals are almost exclusively occurring in people who have underlying conditions that suppresses their immune system. So I'm just going to end with 2 points and then turn it over to Jennifer. One, vaccines do not prevent infection completely. And so it's expected that we're going to see some mild and moderate disease. And two, the severe disease that happens in vaccinated individuals is in the context of people with severe underlying conditions.
Thanks, Bill. You two are a dynamic duo. Jennifer, I turn to you for terminology that you dislike.
That was perfect, Bill. A really great explanation. I hope people can share that clip of your explanation, because this question comes up so much. And it's one of the reasons why I wish we would call it breakthrough disease and try to better understand how frequently that occurs and whether the occurrence is something that we can live with, or if we need to take additional action to stop it. So far, I've been quite encouraged that people are by and large very well protected from their vaccines, and that the vaccines keep the infection that people have to quite mild symptoms.
Thanks, Jennifer. That's going to be the last word for today, since we're coming up on 12:30. I would like to thank Jennifer Nuzzo and Bill Moss for joining me today. Give a big thank you to everyone who joined us, and especially to those of you who submitted questions for our experts to answer. This briefing will be archived and available at coronavirus.jhu.edu. As a reminder, we will offer these 30-minute briefings regularly on Fridays at 12 p.m. We'll be back next Friday, October 7th at noon. I'll look forward to seeing you next week. And until then, thanks and stay safe.